So as we get older, things start to nag us. I'm not talking about spouses, Mary. That's not what where I'm going with this. But the nagging aches and pains, which we assume just come with age.
But for someone who's young to experience joint and muscle pain, it's not common. And for Jennifer Connor, the search for relief lasted about 10 years.
Yeah, she's here along with Dr. Drew Drummond of the Spinal Balance Health Center. Good to see both of you this morning.
Welcome back.
And Happy New Year. This is your first visit.
Yeah, it is.
2014.
It's nice.
Did you make? You're into health so much.
Yeah.
Do you make resolutions?
Well, I do. I have my personal ones like everybody else does, the exercise and the diet like we all need to do. But professionally at Spinal Balance Health Center, one of the big ones we have is to just try and educate Omaha about upper cervical care because so few people know about it. So we'll be going out in the community and doing a lot of free posture analysis to people. In fact, this month we'll be at 24-hour fitnesses through the month, Elite Fitness. And then, of course, we're going to keep coming back to the Morning Blend and bringing patients like Jennifer.
Well, it is about spreading the word. For you, you had some bad symptoms. So what were you experiencing and for how long, Jennifer?
I can't really pinpoint like when it started, or it's been so long since I've been in pain, but I thought it was just from working in like a physical job for so many years. I just thought it was like wear and tear on my body, but Dr. Drummond had asked if I had been in like an accident or had trauma, and I'd been in an accident when I was 18, so we kind of thought that's where the pain had stemmed from.
I think so.
But literally my entire left side of my body was in pain.
So you're talking your joints, your muscles,
Yep.
and then you even had headaches as well.
I had foot pain, lower and upper back pain, neck pain, shoulder, and headaches for about 2.5 years
just
every
on the
day.
left side?
Just my left side.
How was that affecting your daily life? You were still trying to work.
Yep,
You're
still
a
working.
mom.
Yep. It's hard to keep up with the 6-year-old when you're in pain all the time.
Yeah.
He's very active, but it was very hard for me. But
Yeah.
you just kind of struggle through it, and it became such a constant that I just dealt with it. And
Well, you dealt with it for 10 years, didn't you?
Yeah.
10 years. Did you try other treatment options? Did you go
I did.
see other doctors?
Yep. I'd seen a handful of doctors for my headaches. Had done physical therapy and a chiropractor as well. So.
And nothing was giving you the relief? you were
No,
looking
the
for?
medication they would give for headaches
Yeah.
either didn't work or didn't, in fact, made me sick.
So why did you try one more thing with Dr. Drummond, and then what did you experience?
My father-in-law actually recommended Dr. Drummond. He's a patient as well, so I'm like, why not give it a shot?
Yeah.
You know, and within a week and a half, I was headache-free, and I still have not had a headache
That's
since.
remarkable.
Yep.
That's remarkable.
Wow, that's crazy. So you went in, you got an adjustment from Dr. Drummond, and then at what point did you start experiencing some relief from that pain?
I think after my 3rd or 4th visit,
Yeah.
I was headache-free,
Yeah.
and then the neck and the arm pain and all that slowly went away as well.
What she's talking about is NUCCA care.
Yeah.
This is your specialty.
You bet.
What is it? What are you spreading the word about this year?
What causes a lot of people's problems with joint pain, neck pain, headaches, digestive problems, a lot of things, it's really problems with the nervous system. This is the underlying coordinating system of the body. There's I think a video we can cue up that shows how the nerve impulses start up in the brain and they are sent down through the spinal cord and out to the rest of the body. And this is the system that controls everything, every other system, whether it's your digestive system, your musculoskeletal system. And when this isn't working, it'll throw your posture off, it'll cause blood flow problems to the head, it'll just a myriad of problems. So the biggest problem to this system, or the most common one, is a misalignment at the top of the neck through whiplash accidents and things like that, or things a lot less significant. It can go all the way back to birth trauma. So we analyze a person's misalignment at the top of their neck, and we cater a correction specifically for their misalignment. And once we get the nervous system functioning better, their body just starts functioning normally again.
It's amazing how many issues can be created just from
Yeah.
that misalignment. For Jennifer, she had joint pain,
Whole-
muscle pain,
Yeah.
whole left side, headaches.
Yeah.
Yeah.
It's one of the reasons people have such problems with a lot of their health issues is that there are specialists and different kinds of doctors that treat different areas of this problem. It starts at the top of the neck, affects the nervous system, and then spreads out. So you can have one doctor for the low back, one doctor for the headache, one doctor for the hip pain, one doctor for the foot pain. And in reality, it's just one single problem, and that's why it's so hard to chase it down. But if you can get to the original misalignment, I mean, you can get your body functioning better again.
Do you need a referral from another doctor to come see you?
You know, like most of our referrals are like with Jennifer. It's a friend or a family member
Yes.
that came in and they saw us. Most of our professional referrals will come from other chiropractors. NUCCA practices under the umbrella of chiropractic care. So If other chiropractors are struggling with an upper cervical issue, we'll get that kind of referral. But a medical doctor, a surgeon, a physical therapist, they are not schooled on this type of care. It's not in their educational package. So that a lot of times they don't even know about it. So no, you don't need a referral. Really, you just need to call us.
And Jennifer, your reaction, I mean, I guess you wouldn't have expected it, because after 10 years of battling with these issues, and then you go see Dr. Drummond, and then you've got some sort of relief, I'd be screaming this from the rooftops. Go see this guy, you know what I mean?
Yeah.
Are you recommending
Yep,
him?
absolutely.
Yeah.
I've got a lot of people I work with have back pain, so I'm kind of the guinea pig, and it's worked, so hopefully they come see you.
Is there a way to know for sure if you're a candidate, Dr. Drummond?
Yeah, there is. It's there are some qualities of a person's posture that I can look at and will tell me if there's a real good likelihood of there being an upper cervical problem. And we always start out, before we start any kind of treatment, just looking at a person and saying, yes, you look like this is what your issue is, or no, I don't think that this is right for you.
Yeah. Well, you've brought our viewers each visit this offer, which makes it so affordable for people to just say, I'm going for it.
Yeah.
I've been dealing with pain for years. I can manage $50 just to see. So the first 30 people who call Dr. Drummond's office, you get a consultation, an exam, and x-rays. That entire package is $50. And so here's the number to call in case this applies to you or someone you know could use this. Make sure that they're calling 452-3400. That's 402-452-3400. You could also learn more about the Spinal Balance Health Center online at spinalbalancehc.com. This is a local office. You're not a national guy who's
we're in
popping
Millard.
into Omaha.
We're moving into a new office in April. We've got a new doctor that just started this year and another one coming in next year. So we're growing very quickly. It's people are learning.
But in Millard at the moment, Dr. Drummond, it's nice to see you as always. Happy New Year.
Thank you.
And
Thanks
Jennifer,
for
nice to
coming in.
meet
Thank
you.
you.
Congratulations on
Thank you.
feeling good.
Great success story.
Yeah.
And if you like heartwarming,